I will be performing a Foley insertion today, and I'm going to read the integrity statement. So, as a responsible and ethical learner, I will uphold personal integrity by not engaging in any form of cheating, unauthorized collaboration, fabrication, falsification, or any other act that compromises the integrity of the skills testing recording. All right, so before getting started, I'm just gonna check that the orders have been sent to perform a Foley slash like catheter insertion. So check that, we're good to go, and then I'm gonna go ahead and get started. So I'm gonna start by entering the room. So knock, 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 may I come in? Yes, you can. Hello, I'm Shea, I will be your nurse today. Do you know why I'm here? Yes, so you are going to be getting a Foley. Do you know what that is? Yes, okay, you've had it done before? Perfect, so yeah, I'm just gonna insert it. There's gonna be a little bit of pain, but it'll help relieve that tension that you're feeling in your bladder. And so can I confirm your name and date of birth, please? All right, yep. Okay, perfect. I'm just gonna beep that and then have my mar up with like the allergies. So before we get started, do you have any allergies that you'd like to tell me about that weren't mentioned? No? Okay, no allergies to iodine, latex, any adhesives? No? Okay, sounds good. So I'm just gonna close this for privacy. Okay. All right, so I'm just going to go ahead and kind of feel for tenderness. Before I do that though, I'm just gonna wash my hands. So you said you're feeling some tenderness in the abdomen area. Okay, let me just palpate. So I'm gonna go ahead kind of like above the pubic symphysis or the symphysis pubis, whatever you want to call it. I'm just gonna go a little bit above that. I'm gonna press on it, feeling for any tenderness or pain, and then we would get a bladder scanner if available to see if there's a lot of bladder in there, a lot of urine in the bladder. Okay, so did that. All right, so I'm just gonna clean the perineal area. So I'm just gonna make sure there's a chuck. I'm gonna put some gloves on. So for the women, for females, we go about cleaning the perineal area by going from front to back, and we will clean the outside portion and then the inside, making sure we spread the labia on and clean on the outside and then the inner. So I'm gonna go ahead and do that. I have a chuck just in case, and we'll also have that for the catheter insertion. So I'm just gonna put this right here, lift up the gown, trying to do as much privacy give them as much privacy as possible. All right, so this is gonna be my wipe. You can do warm water and soap, or you can do kind of like a wipe. So I'm gonna pretend this is a wipe, and you discard the wipe with every wipe. So I'm just gonna go ahead and also inspect the area for any like redness, tenderness, any odor, or like any like discharge, kind of noting that. So I'm gonna go ahead and clean it now. So I'm gonna go to the outer part down, and then I'm gonna spread the labia, clean on the outer portion. So got a new one, going down, getting a new one, down, and then I'm gonna clean kind of like the urethra area, so going down. All right, so that's clean. So this is just gonna be discarded into the trash can. All right, and then she's already on a chuck, so I don't need to put this down because she's already on one. But if she wasn't, I would roll her to her side, or I would have her lift her hips up to put the chuck underneath. All right, so I'm gonna open my sterile, well, I'm gonna have a sterile field, but I'm gonna actually, before doing that, I'm gonna remove my gloves. So gloves are removed. I'm gonna perform hand hygiene again. All right, and then I'm gonna open my sterile box, what have you. So I'm gonna grab this, and I'm gonna maintain sterility this entire time. So once I open this, that's like our goal. So I'm just gonna do like 1 inch border, going away, making sure I'm not going over it. All right, so that's good. And then I'm gonna actually move this up so I can do, I mean, technically I wouldn't go over this. Let me just clear some space so I can do the gloves. All right, so I'm gonna grab my gloves. They're gonna be completely sterile because we need this to be as sterile as possible. So here we are. I'm gonna open them, making sure not to touch this portion. So opening up the gloves, making sure I'm just touching the sides. All right, so I'm gonna grab my glove, making sure to maintain sterility. Hands are a little sweaty, but that's okay. All right, so I got that on, and then I can fix this with the other glove. All right, just open this. And then, are you okay? Are you comfortable? Yes? All right, sounds good. All right, and then I'm gonna pull this down. I can fix this because it's sterile. All right, we're good with that. Okay, so sterile gloves are on. I'm just gonna grab this, and then that's going in the trash. All right, so now we are going to just lay this down as well. This is not a chuck, but it just kind of, it's sterile, so it's gonna give some more working space, some more sterility. Oh, and we'll put the shiny part down because that's the waterproof side. So it just gives us more of a sterile working field. Okay, and then this sometimes comes in it, but I'll lay this down too to just, it helps with privacy. Yeah, giving that patient some more privacy. All right, so now that's in place. So we're gonna prepare the fields. So I have my iodine swab sticks, and I would just open that, have those ready. And then I have my lubricant. I'm actually going to, I am going to actually use this lube today. So I'm going to put some on the area just to prepare so I can lube up my catheter. And then I have this. I'm gonna connect this to the catheter because this is gonna be the balloon. All right, so maintaining sterility, I wanna take out my catheter. There would be a plastic guy on here, but that's not the case. So here it is. I'm not touching the end. I'm gonna lube it. So just lubing it up. Okay. So that has a good amount of lube on it. All right, and then I gotta connect my syringe to the catheter. So I'm just gonna take the cap off, connecting it, making sure there's no bubbles or anything. There's none, so we're good. So I'm just gonna connect that. All right, so that's connected. It's lubed up. These are hypothetically out. So I'm gonna go ahead, and so the position for the female is just to have kind of they're gonna be lying on their back in the supine position. They're gonna have their knees out, kind of like in a butterfly position, have them do butterfly. And so I kind of already got her in that position. For males, they're just gonna be also in the supine position, but they're just gonna have their legs straight and then like a little bit out. So this is a female, so I had her do like the butterfly position. So my next steps are to clean her with the iodine solution. I would use my hand, my left hand and my right hand, and I would swab the iodine around the either urethra, the ureter meatus, what have you. So you'd swab that 3 times, discard. This is discarded. Okay, and then now I can go ahead and insert the catheter. So I'm making sure that this does not touch anything. Okay, and I have my bag. So I'm just gonna go ahead. So it's 2 to 3 inches. I'm gonna insert this. So my hand is gonna be here from the iodine. So I'm just like opening up the labia and then I'm gonna insert it. So I'm just gonna go ahead. 2 to 3 inches is usually the protocol. And you also get some urine return, just to know how much to insert. So I'm getting some urine return. All right. So I'm gonna go ahead and place my balloon in here and see how it goes in easily. If it doesn't, then you just have to push it in a little bit further. All right, so I'm just gonna take this off. All right, and then I'm gonna tug to see if it's it's good. Tugging, not to tug too hard. Okay, and then so there's some good urine return. I'm gonna go ahead, make sure there's no kinks preventing the urine to come out. As you can see, there's urine. And then I'm gonna go ahead and hang this on the bed. Also making sure, so I'll just usually rip this, but for the sake of saving materials, I'm gonna tape this to her leg. And then after taping it, I'll hang the bag on the bed. So to do that, there is an area to do so right here on the bed. So I'm gonna hang that there. And then once that's hanged, and then I would take this off, but I can't because I'm gonna save it. I would just make sure she's comfortable, there's no pain. I'm just gonna constantly monitor it, document, but before documenting, gonna clean up, make sure she's good to go, get rid of all this, document, put the bed in the lowest position, and then and that's the Foley.